I want to record the session. Okay. All right, everyone. So again, once again, whoever is joining me now, a very, very good evening to all of you. Let's start our session. Importance of pelvic floor and what is Kegel. I'm going to give you some highlights on this topic. I have this pelvic model with me today. So through this pelvic model, I try to make you understand about this very, very important concept. We all are familiar about this pelvic bone and we have this floor of this pelvic bone. Everywhere you can see that one muscle is attached. It's kind of which is creating the floor of this area. So they are the muscles which is attached beneath the pelvis area. We are calling it, which is making a floor of this area. We are calling it as a pelvic floor muscle. And because these muscles are present, so the muscles as well as the bony walls, they are creating a cavity. So this is a cavity or area is present inside our body. And into this cavity, we have very, very important organs. The first organ, if you'll see that we have our bladder. So this is the bladder which is situated inside our pelvic cavity. Second organ which we are having is uterus. So bladder is having a urethra, uterus is having a vaginal canal. So they both are situated into the pelvic cavity in a female body. The last organ is the rectum with the anal canal. So three organs are present and all these three organs are having the three canals. And all these three canals are passing through this particular areas. We call this area as a hiatus. So we have three openings into this pelvic floor in this area: urethral opening, vaginal opening, as well as anal opening. And all these canals are passing through the pelvic floor. So pelvic floor is very, very important muscle. There's no bony surface, nothing is there. It's only the muscle which is giving the support to all these three organs in a female body. Organs will be positioned, placed in a right way. So from anterior to posterior. So very, very important this muscle is. And unfortunately, this muscle was not taught to us during our curriculum time. And it was not mentioned in detail or not even mentioned in our syllabus once we did our bachelor's. And we don't know what is the reason behind that, but what I am expecting, or I'm just thinking the reason can be the sensitivity of this area, because this area is very, very sensitive and we never talk about this particular intimate or this private parts. The muscles are somewhere present around this private and personal area. That's why it was missed. But the muscle is present, and into a private area, many things happens. So if you just want to just ask me, every day we are urinating. So we have a bladder. Bladder is going to fill a lot of, there are two functions of the bladder: filling of urine and now passing of the urine. So for filling, and we need this bladder, and after that we have this opening. Once the bladder is completely full, we have to evacuate. For evacuation, we have this bladder. So through the bladder, urine is going to come outside. But we don't want the urine should keep leaking and keep going outside. So for that reason, we have the base, pelvic floor. So pelvic floor muscles are going to work as a sphincters, as a external anal sphincter, the external like urethral sphincters. I'm sorry, not anal, external urethral sphincters. So pelvic, all these small muscles, they are wrapped around the whole urethra. And now, if the bladder is full and I want to pass the urine, but I'm stuck somewhere or someone is inside the washroom, I am not getting away to pass it. So in this time, I should not be leaking. My pelvic floor muscle should come and try to create a compression. So voluntarily, I'm able to hold the urethral area. And this voluntary compression, I'll create a compression. So external anal sphincter will come, external urethral sphincter will come, and they will create a compression. And because of this compression, I will manage the continence. I will not leak. And once I found that I have to pass the urine, my pelvic floor, they will go away from this and I'll pass the urination, I'll urinate. So pelvic floor is working as a sphincters, closing and opening, depending upon the need of a body. And these pelvic floor are working in a coordination of the as per the demand. What is the demand of the body? So pelvic floor is very, very important for urination, for your bladder health. If pelvic floor muscles are weak, we are going to have those kind of issues like urine leakage. And you might have heard about this urine leakage word, and it is kind of very, very common. And many females, they are suffering from, many males, they are suffering from after some time. So if you just ask me, I'll say that 1 out of 3 females, they have this kind of issues. So the issues can be, it can be because of any reason, but urine incontinence is there. So you can even ask your in your family itself, your grandmother, your mother, your auntie, your sister. They are going to tell you that yeah, some sort of this leakage is there into their life also. So many females we can find out in our near one as well. So that happens, that can happen because of the weakness of the pelvic floor. So very, very important. So whenever our female is having urine leakage, and that can be because of the weak pelvic floor, we can assess the muscle and then we can give them the right rehab protocol. Same way, it's not only this organ, there is another organ which is present. That organ is a second canal. We have a uterus, and uterus is having this vaginal canal. And this vaginal canal is also passing through the same pelvic floor muscle. So in this image, in this model, you can see the second opening. So you can see like me also from here. Okay, so this is the second opening. So this is the opening of vagina. So now you can see in this muscle, this is all muscles which is wrapped around the vagina. So vaginal orifice is this one, and we have special important muscles present here. This we call it as a bulbocavernosus muscle. We also have some muscles at the inferior side of vagina, this particular area. So perineal body, we also have some muscles. So all these muscles can, we need this muscle should be, it is very important. They are playing a very important role. So whenever we want to insert something inside the vagina, so we want to go inside at that time, we want relaxed muscles. We don't want tight muscles. So muscles should be completely relaxed and open up. So they are also work as a sphincters around the vagina. And if they will be relaxed, the penetration inside the vagina will be easy. And if these muscles will be tight, so sometimes there's no penetration. So because muscles are too tight, they have a trigger points, they have kind of spasm. So because of the spasm of this muscle, specifically this muscle, bulbocavernosus, if the door will be closed. So if the door will be closed, the female will have tightness. Even Q-tip test, the earbud, you cannot even touch the earbud into this area. And you cannot insert even the simple, smallest thing inside the vagina, even the Q-tip. So that can be very, very difficult situation for the female, that she cannot insert anything inside the vagina. So that female situation, you can understand what will happen with this female when she is going to start her sexual activities after whenever she wants. It is up to her choice. And if during the time when she want to, sexual activity is very, very important after a certain time in her life, during that, when she's going to start her marriage life, after the marriage. So, but she can't do sex, or she can't do intercourse, or she can't do penetration because the muscles are very tight. Believe me, girls, many of the women, they are suffering from this condition. We call this condition as a vaginismus. So very, very important. We have to understand the muscles which is tight here. We should try to, the patient, we as a physical therapist, we know how to relax the muscle. So vaginismus is a one condition which affects 2 out of 100 girls. So if there are 100 women, out of that 2 women will have this kind of issues where the muscles are tight. And why these muscles are tight? There can be many reasons behind that. One important reason is the sexual abuse during the childbirth, during the childhood. So someone has touched us unnecessarily without our permission, we didn't like it. So that can always create like kind of a guarding reflex. So pelvic floor has a tone, and that tone is most of the time hypertone. Okay, so now also you are listening to me into this webinar, but still your pelvic floor is having some tone, and that is a maintained tone. So so it's a kind of higher tone actually, because this is a transversely situated muscle and it has to work against the gravity all the time. So balance itself. So very, very important that, and this because of some sexual abuse or some unnecessary touch, or not only this, even the negative mindset since the childhood, we keep listening this word that don't touch this area, it's bad area, it's not a good area. So we somewhere prevent, and we create some kind of tension into this area. That can be one reason creating the tightness in pelvic floor. Or sometimes some kids during the habitual pattern, we have this tendency to hold the urine for a long time period, hold the stool for a long time period. So whenever we are holding, we have that kind of habitual pattern that can also create tightness into this muscle. That can be reason the patient can have a big tightness into these muscles, and because of the tightness, she will not be able to penetrate anything inside the vagina. So she can get vaginismus. Not only the superficial muscle, so this is a layer of superficial, we have a deeper layer also of pelvic floor. So if I remove this, we have this whole levator ani muscle. There are layers of this pelvic floor. I'll tell you about this in sessions, in workshops or online sessions you can learn. So we have a levator ani muscle, which is a deeply situated muscle. Sometimes trigger point and tightness can happen into this muscle. So many of our females, they will complain you that they are having pain during sexual intercourse. So it means the pain is not during the penetration. Penetration, they can penetrate, they can go inside the vagina, they can insert the finger, there's no problem. But whenever they are having a sexual activity is giving them pain. So that can be because of there are some kind of spasm into the levator ani muscle, deeper muscles. And that spasm can come into picture because of many reasons. Like you can see, the reason can be, you can understand endometriosis. If some female, she has endometriosis can create adhesion. So that adhesion, because of endometriosis, can give a trigger point and spasm to this endopelvic fascia or this muscle. So that can get tightness and trigger points inside. Not only the endometriosis, which one condition, even any surgery which happen into the pelvic organs, any surgery can create adhesion. Even the laparoscopical surgery, which is like very minute 5 mm hole they are going to do. So that even laparoscopical surgery can also create a scarring, adhesions inside. And if that adhesions happen anywhere into these three organs, so something happened, so any adhesions into these three organs can refer those tightness, so they are passing through the muscles. So let me just make just simply, if I'll just, this is a muscle, okay, so this is a passing through that, this muscle is passing through, okay. Let me just try to insert. So this is the one organ, so urethra is passing outside, and we have the second organ is vaginal canal. So that is also touching. So you can pass that through the pelvic floor. It is also passing. And the last one is the rectum. So that is also, anal canal is also passing through the pelvic floor. So you can see this is how the pelvic floor, these canals are gonna come in direct contact with the muscle. So anything happen to the organ can give a referred pain to your pelvic floor. Anything happen to your pelvic floor can give a referred pain to your canals. So sometimes something happen into this internal structures or any inflammations or any adhesions, they can always affect our pelvic floor. The layer which you are looking at right now is a deeper and superficial layer. But don't forget that the organs are coming in direct contact with the levator ani. So all these three holes which you are seeing into this image, so they are the first contact of the organ with the pelvic floor. So in this way, we can have a trigger points into levator ani, and that can again give a lot of issue to our female during sexual activities. This problem, which we are calling it as pain during sexual activity, is a dyspareunia. So I'll tell you that what I have seen, what is written into the statistics, like 5 out of 10 or 10 out of 100, 5 out of 100 or 10 out of 100. But believe me, I have seen this very, very common problem. Like you can see that 20 out of 100 females, they have a sexual pain. So sexual activity is an activity which is a pleasurable activity. If I'm having pain during that time, my brain will not get pleasure. If my brain will not get pleasure, I'm going to have, I will not enjoy my sexual activity. So dyspareunia is again a condition which is affecting many of our female. And vaginismus and dyspareunia is very, very common. It's very, very common after childbirth. Once baby is coming through the vagina, you might have heard about episiotomy. It can be the midline and mediolateral. You might have heard about perineal tears. So during that particular conditions, during that particular incidents in our life, our muscles, they got torn, they got incised from from the center. So if I'll say, so this muscle, this particular area, so what is a midline episiotomy? They're going to create a cut into the center. So because of the central cut, the muscles will get separate from each other. And it can be the mediolateral cut. So in this case also, you can see this muscle will get separate from each other, and even this muscle will also get affected. They're going to incise these muscles. So it's not only the skin and tissue, it is even the musculature which is getting cut. And that incision is gonna now heal after, and healing is gonna happen. Healing is going to give you adhesions, and because of the adhesion, all the side will get tightness, isn't it? Because adhesion means creating tightness. So these female will develop dyspareunia after the childbirth. So we call it as a secondary vaginismus or secondary dyspareunia. Sometimes midline episiotomy, it can be midline episiotomy, it can be like complete tightness into the center, or mediolateral tightness can go into one center. So in this way, if one side is tight, so if you want to understand the biomechanics of this whole pelvic area, so you can see if they have a like one side of tear, like midline episiotomy on one side, so what will happen with the SI joint? So that this female will have a tightness here, which will pull the ischial tuberosity in this side because of the tightness. And that is going to put loading on this side. So this side will get tight and this side will get weak. And that is going to even affect her whole biomechanics of the pelvic girdle. So she will always keep telling you the pain around SI joint also. And there will be source of SI joint pain, that will be source of even the secondary vaginismus and secondary dyspareunia. And back pain will be also come into picture. So very, very important that we should learn how to assess the muscle and how to create a rehabilitation of this particular area. If female is suffering from vaginismus and dyspareunia, muscles needs to be relaxed. Like we have a trapezius, so how we are relaxing this muscle. So same way, we can use a lot of modalities, like we can use TENS, we can use ultrasound, we can use cryotherapy, we can use IRR, heating modalities to create a relaxation, as well as the manual therapy, trigger point release techniques, Thiel technique, Thiel massage, perineal massage. All this is very, very important. They are creating a big role in relaxing the muscles, and we can treat our females, and we can give them the quality, we can increase their quality of life. And then next time, whenever if they have a good and relaxed muscle, next time they will have sex, so they will not have pain. So they can enjoy the pleasure. Same way, not only this, we also want all these levator ani muscles should be relaxed. So during the childbirth, so at that time also, we really want that she should have a relaxed pelvic floor. She should not have any tightness into the pelvic floor. If she will have tight pelvic floor during the childbirth, the baby can stuck inside the vagina, and labor stage 2 can be prolonged for the female. So we also try to help our female in making her life very easy. And we can even prevent the episiotomies and perineal tear by creating a relaxation during the pregnancy. So there are many exercises, many therapies, many stretching techniques which can through which we can help our female. Same way, if you will go more backward, more posteriorly, so we have a rectum, and rectum is also having the anal canal. So this anal canal is coming out through, you can understand, this particular hole. So this is one levator ani which is coming into picture. So we have one important muscle which is of the levator ani, and externally you can see we have an external anal sphincter. This big muscle is also wrapped around the whole anal. So this is the anal canal, okay? So through that we have this external anal sphincter. And this external anal sphincter, again, when we are talking about the sphincters, so you can see this is a canal which is passing, and this is how I'm making it just come into in a correlation with it. So now this is the canal, and every day we are gonna go for defecation. So during the defecation, we can't just pass it. We can, the stool cannot just leak out like this. Whenever we want to, it's like depending upon me, when I want to evacuate, when I'm ready. So whenever I'm ready, I'll sit down, and this particular fibers which is present here, this muscle, levator ani, that will relax. The name of the muscle is puborectalis muscle. So that will relax, and the second, this muscle, external anal sphincter, they will also relax, and they will release the pressure from the canal. So the canal will be open, relaxed, and the stool is passing of the stool will be easy for the person. But if the muscle is tight, so patient can feel pain, they are not able to pass the stool. So they are not able to pass the stool. There can be two reasons. One reason, because of the poor dietary habit, she has a hard, tight stool, or it can be the consistency of stool is good as per the Bristol scale, but the muscles are very tight. So she has a tightness into this pelvic floor, and they are not letting the anus relax, and the defecation is difficult for those females. So again, we as a physical therapist can relax the whole external anal sphincter through transrectal approach, and even the puborectalis muscle also, we can relax that. And sometimes, so whenever there's a tightness into the muscle, anywhere around the canals, we can definitely relax that. Tightness can give pain during urination, pain during sexual activities. Tightness can give a female pain during defecation. It can give her a constant pelvic pain. She don't know what kind of pain is there. Pain can be more during the periods, because she has all this internal involvement of the levator ani with this internal structure in correlation with this uterus and the vaginal canal. So she can have like pain, chronic pelvic pain or pain syndromes inside. So we can definitely help a lot of patients. And same way, if the muscle is weak, so the muscle don't have a strength, as I told you, any muscle of our body, it can contract or it can relax. So we have to contract always. We have to maintain the tone. So the muscle is loose, weak because of anything, because muscle is situated transversely, loading, constant loading is falling onto that from, whatever load is there into the abdomen. So there might be obesity, there might be pregnancy, which is creating extra loading, or our valsalva, the activities where we are increasing the valsalva, or some jumping exercise, jumping activities that can always put loading onto this muscle. So the tendency of getting weakness is there. In the same way, we have a gravity also. So gravity will keep pulling the muscle down. So muscle is prone to get weakness into life. So if the muscle will get weak, so you cannot understand, the holding compression will get weak. If the compression will get weak, so patient can have a urine leakage problem. She might have even problem in, the stool leakage can also come into picture, or passing the gas. She's not able to hold the gas because muscles are not able to create a compression. So that is again a weakness. And sometimes there's too much of laxity inside that muscles in this area. Female can have even like they don't sense anything inside the vagina. So there will be no sensation when they will have intercourse, because muscles are so loose that they cannot feel the penis inside the vagina or sexual organ inside the vagina. So once there is no feeling of sexual object or sexual organ, so means they will not like having the sexual activities. So again, sexual dysfunction will come into picture. They might don't hit orgasm. Orgasmic dysfunction will come into picture. So in this case, pelvic floor muscle is very, very important. Not only that, sometimes muscles are so weak that they cannot even create a good positioning of the organs. So they will keep pulling the organs downwards. And because of this, organs can start displacing down. And one problem can start, that is a pelvic organ prolapse. So you can see that these three organs can start coming outside. So because we have a central muscle, central canal, vagina, and that is center of gravity is crossing through this vagina. So patient can have something coming out, falling from the vagina. It can be the bladder, cystocele, rectum, rectocele, or uterus, uterocele. Believe me, girls, there are many doctors who are working with all this health, organ health, but no one is working with the pelvic health. This pelvic health is missed. And we know that urologists, sexologists, or gynecologists, or colorectal surgeon, they are doing their work at their maximum capacity, efficiently. But that particular, and they are always, whenever they are treating this door, they are always going, they are treating these organs, they are always coming through the door. But no one cares about the door. Door is always weak, or it might be tight. So we are the people, pelvic, not the pelvic, we are the people, physiotherapists. Physiotherapists are the one who are working with the muscles. So that's how if we specialized into this pelvic floor and this by understanding the pelvic health, by the understanding this organs health as well as the correlation with the muscles. So we can definitely, 100% we can help our patient. And vaginismus, no solution. When the vaginismus is there, still now, if I tell you, many of the female, they have a problem in different part of the corner. And no one can treat the vaginismus, no sexologist, no gynecologist, because it is a muscle-related problem. We can treat the vaginismus. And very, very important, our role is. Now, this is the simple understanding which I gave you about the importance of pelvic floor. The second thing is Kegel exercise. So you all might have heard that if pelvic floor is weak, we can go for Kegel. So let me first introduce you about what is Kegel. So Kegel this name comes from one very, very renowned doctor, Dr. Kegel, and he was a gynecologist who was practicing in America in 1940s, that particular era. So he somewhere found out, that these muscles, there are muscles inside the body of inside, and those muscles, because he was doing, it's like about this story which I know about Dr. Kegel, that he was doing some examination, some assessment with one finger, with one female, and his finger was inside the vagina of a female, and suddenly, like a female, she created the cough or sneeze. I don't remember. She increased Valsalva. So because of this sneezing and coughing, he found sudden contraction on his finger because his finger was inside. Once he found sudden something contracted or something closed, something put pressure. So he asked the female, can you do it again? Can you cough again? So he created again, he again felt that particular, squeezing. And then he came to know, and he go into the detail, and he found out that we have a very, very important muscle present into this when we are entering our finger inside. So we have muscles present here, the skeletal muscles present here. So if they are skeletal muscle like our biceps, if we can strengthen the biceps, we can also strengthen the pelvic floor, these muscles. So he always tried to do, whenever he was inserting his finger, he always asking the female to create a cuff. And he found out, yes, muscles can contract under our command. If we'll give the command, it can contract. And he started asking a female that if the contraction is there, so can you hold the contraction for some time? So he started working on how to increase the power, because there was many female who were suffering from urine incontinence. So urine incontinence means these muscles are wrapped around the bladder. If we increase the strength of this muscle, will help in strengthening the door. If the door will be closed, we might get rid of this problem. So this is what he did. He tried this for all his patients, and after 2 years, he found out that whenever he was giving this contraction, he was asking the female to contract pelvic floor, specifically pelvic floor. So he found improvement in the symptoms. So all the female who were suffering from leakage or they were having some kind of leakage issues, so he found out the muscles, we can strengthen the muscle. Then he gave this particular exercise his name, and the whole world is knowing the Kegel exercise. And then he started, even he invented periometer also, just to check how much the pressure the muscles can create. And then what happened actually, he told that, okay, whenever we are squeezing the muscle, if we want to increase the strength, so minimum 10 seconds of hold we really need. So he gave this one protocol that squeeze the pelvic floor for 10 seconds and relax. And do that for kind of 10 times and repeat it 3 times. So 30 contractions into the morning, 30 into the afternoon, and 30 into the evening. If the female will do that, she can see the improvement into the pelvic floor. We can maintain the strength of the pelvic floor. This is what the Kegel is actually. But unfortunately, the world perceived Kegel in a different way. The world found they started telling that if there's a pelvic floor problem, give them Kegel. So even whenever there's any problem related to this area, like vaginismus or dyspareunia or painful urination, painful defecation, so they are the condition where pelvic floor is already tight. They also already have a hypertone. So in those cases, when already the structure is tight, they still prescribing the Kegel, because only this word is like famous. Go and give Kegel if something happened with the pelvic floor. But Kegel is very, very important when your pelvic floor don't have strength to hold. It lose its endurance, its power. Then the Kegel we can give to our patients. Squeeze the pelvic floor for a certain amount of time and do this protocol, follow the protocol. So that will be effective. But in case of when the muscles are already tight, we should never give Kegel to our patient. Once the patients are coming to me for the rehabilitation, for the treatment, in the file, whenever I'm going through the files, it is written into the files. In case of vaginismus and dyspareunia, do Kegel. So my patients are doing Kegel since 2 years, 3 years, and they're building more tightness with the pelvic floor. So this is the fact about the Kegel, and I will tell you that where we have to do Kegel when the muscles are weak, loose, they can't hold. So weak, loose muscle, they don't have a tone. So hypotone, tone is not there, it is hypo, down tone. So when there's a down tone, hypotonous conditions, so leakage is going on, pelvic organ prolapse is going on. So if they're not able to hold the gas, they are not able to feel anything inside the vagina, they are having a problem with the orgasm, they don't feel anything inside the vagina during sexual activity, definitely the Kegel can be a big help. It's exercise. We can strengthen the muscles by creating this kind of maximum voluntary contractions and hold that contraction for some limited time period. It can be 5 seconds, 6 seconds, slowly, you can progress up to 10 seconds. So yes, Kegel is a big help. It's a good exercise where we are creating a contraction. But the same Kegel is not prescribed, it's not good for the patient who has a hypertonous pelvic floor. The tone is hyper. So female is having a pain, difficulty in urination, defecation, or sexual activity, or she has any pelvic pain syndrome. So in those, any kind of deeper pain she's feeling inside the pelvis region. So definitely no Kegel. So on those cases, we should not contract. Our focus should be on to relaxation. So we can use the word reverse Kegel. So no contraction, relaxation. So Kegel for contraction and reverse Kegel for relaxation. It means no Kegel. Okay, reverse it. So instead of contracting, you try to relax the pelvic floor. So this is a simple understanding about the pelvic floor. Let me take you to my PPT and where you can just go through. If I miss something, I don't want to miss anything. So let's go through that PPT also for a better understanding. And just a quick recap. So yes, pelvic floor is very, very important. So yes, pelvic floor is very, very important, and this is our important pelvic floor, and all these organs are situated into the pelvic cavity. You can see this is a pubic symphysis. You can palpate your own pubic symphysis. You can palpate your tailbone, and we have these organs in a female body: bladder, uterus, and rectum, and we have these canals, which is passing. This is all red color structure is a pelvic floor. So the canal is passing through the pelvic floor, and these are the structure in a male body. You can also see they also have a pelvic floor. So the problem can happen in a female. Same way, the pelvic floor dysfunction is very common into male also. You might have heard about one very common problem, erectile dysfunction. So in that case, pelvic floor is weak. Sometimes pelvic floor can be the culprit. So pelvic floor can lose its strength, and there is no strength, and it can affect the male erection. So erectile dysfunction can be treated by the rehabilitation of the pelvic floor. And not only this, we have many patients, they can have some problem into defecation. Again, their muscles around the rectum or around the anus can get tight. Same way, like we are getting problem around the anus, piles, hemorrhoids, or constipation, defecation problem, painful defecation, and not able to hold the stool. All these things male can also have. Not only the male or female, even our kids, everyone is having pelvic floor. Our sports people, they are always lifting a lot of load. They are always doing a lot of strengthening protocol for their body. They take care of the strength of whole body, biceps, everywhere, upper body, lower body. They maintain the strength, but they never do strengthening of this pelvic floor. And because of that, whenever they are lifting some heavy weights, the load will fall onto the pelvic floor. All the sports people, lifters, weight lifters, they have a weak pelvic floor. So it is very, very important part if you are working in pediatric sector, if you are working in a sports, if you are working with the men health, female health, or if you are working with any health, you know. So this muscle is very, very important, like we have, because this is always loaded and always under the effect of gravity. So very important muscles to take care. And if this muscle, you can see in this image how the canals are passing. If the muscle is weak, so you can understand the muscle will keep pulling the organs downward, and organs are attached there with the help of some important ligaments. So they will be overloaded, load will fall over the ligament, and that can be the reason why the ligaments are getting weaker. And that can be a reason why the patient can have a prolapse. So this pelvic floor is very, very important. It is creating the base, and that base should be strong. So assume you all are pelvic organs, and the room where you are sitting, that room is a pelvic wall. And now the floor where we are sitting or we are standing, that floor is very important. If there is no floor, weak floor will set down. If the floor will get tight, will be squeezed up. So we really need a good floor on which we can stand or we can sit, and we can be positioned. So it is very, very important that we should take care of the health of this particular area. So we have a superficial muscles, we have a deeper muscles, and all together the muscles are doing a lot of functioning. So if I ask you how many muscles are there, so it's not only one muscle. In this image, you can appreciate many muscles are passing. So if I'll tell you, it's altogether 15 paired muscles. So 15 right pelvic floor, 15 left pelvic floor, and they all merge into the center. So many muscles are there, and many muscles, they will work as a supportive. So they are going to provide a lot of support to the organ. They maintain the stability. They maintain the sphincteric action, opening and closing around the canals for our optimum functioning. They work as a pumping circular activity also. So circulation is also provided by the pelvic floor. And so they always create a contractions, and they have a very big role in sexual functioning. So sexual activity should be there without pain, and it should be there where they can, male or female, they can feel that particular pleasure. So pleasurable activity should be there. And it's very, very important that the pelvic floor should be working in a good way, efficiently and effectively. But many factors can affect it. pregnancy, obesity, childbirth, poor repairs from those delivery, prolonged labor stage 2, prolonged history of sexual activities, multiple sexual partners, sexual trauma, some medications, age-related changes, menopausal-related changes, hormonal problem, and anything which is falling, putting load from the top, any weight which is putting load over the top, or intra-abdominal pressure, valsalva. And from downward, you can also see that gravity can always keep pulling it down. So it is very, very important that we should have a good pelvic floor. And whenever there are some stages comes in our life, we should definitely focus more into the pelvic floor. Pregnancy is one particular stage in our life, which is unfortunate that I can become mother, I can have a pregnancy, I can deliver a baby, but the same pregnancy, that particular 9 months of the time, that is going to put a lot of loading on the pelvic floor. And so pregnancy is one culprit, and same way, once we are delivering the child, so you can understand this is the pelvic floor muscle, bulbocavernosus muscle. So baby will come out by creating a lot of stretching around those area. So this is a one side of the female. You can see this side, how the muscles are wrapped around the vaginal canal. And this is the one picture where you can see how much laxity and stretching is going to happen during the pregnancy, during the childbirth with the pelvic floor. And as per studies, 85% of the pelvic floor muscles, they go for separation. So you can understand that after the childbirth, healing is a mother nature, but strengthening is not a mother nature. We have to give strengthening. But if I'll ask you how many of you are mother, and you will get to know that if we are mothers, we never had this strengthening in our life. So that strengthening is missed, and this lead to weaker pelvic floor postnatally. So many pregnancy you had in your life, you will have more weaker pelvic floor. And sometimes baby stuck there, doctor has to do this kind of cut, and they have a cut into the muscles. And sometimes not only the cut, there can be tear, a tearing of those structures. You can understand this is a separation of this muscle. So the muscles which are attached into the center, they get separated, and the incidence is very high. 40 to 85% of female who are going for childbirth, they experience perineal tear. So very, very important that we have to give this rehabilitation to our female, post-natal rehabilitation. And because this rehab is missed, that's why our females are the sufferer of leakage, constipation, endometrial pain, pelvic organ prolapse, uterine tilting, all those things comes into their life. And over tight muscles can be there and weak muscles can be there. And this is one statistics I try to give you. 2 out of 10 females experience pain during sexual intercourse. 1 out of 3 females suffer from the pelvic organ prolapse after menopause. 75%, which is a huge number of women, they have a vaginal laxity. It means they don't feel sex after a certain time, a certain age into their life. So they will not feel sex, you can understand, they will avoid sexual activity, and that is going to even affect the relationship with their partners, which is going to affect their quality of life. So that is very, very important to understand. And incontinence, 2 out of 3, this is the new studies. So it's not only 1 out of 3, 2 out of the 3 people, they are suffering from incontinence. So prevalence is very, very high. So, and that all can be taken care by the pelvic floor rehab. So there is a high need of us. Female sexual dysfunction, as per this, the Journal of Urology, Basson 2000, if you just go through this classification, and these are the problems: sexual desire disorder, arousal disorder, orgasmic related problems, sexual pain disorders. So incidence is very, very high, 10 to 5% persistent pain. You can see that they have a kind of affected sexual life. 43% of women, they have some kind of sexual dysfunctions. So it's a huge number. Like out of 1 female, she's not feeling, she has a difficulty. She might be not feeling sex, or she might having some kind of pain into this area. It can be vaginismus when the muscles are tight. It can be dyspareunia when she has pain during sexual intercourse. It might be endometrial tissues, which is creating a tightness adhesion into the pelvic floor. So it can give her that tightness. It can be the tilted uterus, which can keep giving her this pelvic organ prolapse. So many, many problems are there, and pelvic floor is the only treatment. what I feel like it's a big help. We can do the assessment, right assessment, and we as a physical therapist can assess the muscle, try to find out the muscle is weak or is this like tight. As per that, after assessment, we can plan a good treatment protocol for our patient. And there are scales also. We can even use some scales just to check the health of the pelvic floor. The muscles are tight, or they are hyper, or they are hypo. And according to that, we can always help by creating a good strengthening protocol. If muscles are weak, we can give them strengthening exercises to increase power endurance. We can give lifestyle modification, weight management. We can use some modalities which can improve the muscle functioning, like in IFT and NEMS. We can use bladder training, neck technique, modalities which can improve blood supply, or we can use even some kind of weight, like we are using the weight and resistance training for the strengthening of biceps. Same way, we can use some weight training for the vaginal muscle rehabilitation if the muscles are weak. And we can help our female in all these problems: urine incontinence, laxity, pelvic organ prolapse, decreased sexual sensations, and defecation problem. And same way, if the muscles are tight, she's suffering from sexual pain, pelvic pain, vulvar pain, and defecation problem, urination problem, we can definitely help them by creating a stretching and by creating a more room into those muscles, by relaxing those muscles. And we can teach them the good breathing technique, manual mobilization, pre-healing modalities, cryotherapy, TENS we can use, and ultrasound we can use. So many modalities, whatever we are using in our day-to-day life, same modalities can be used into a female just to relax the pelvic floor or just to strengthen the pelvic floor. Whatever we are doing in the whole body, the whole modalities and whole techniques can be applied onto the pelvic floor, but we should be knowing that how to assess the pelvic floor. So this is very, very important, that we should have a thorough understanding about the muscles, anatomy, physiology, function, dysfunction, causes of dysfunction, how to assess, how to make your patient, like what kind of questionnaires we have to ask, how to make them ready for the assessment, what are the pros and cons, contraindication, indications of pelvic floor, and after assessment, how to create a rehabilitation for hypertonus, hypotonus. This is quite a big subject. I try to give you understanding about the importance of pelvic floor into this 1 hour session, but pelvic floor is very, very deep. It's like a big ocean. So more you will treat, more you will understand, more you will treat your patient. Every patient is going to teach you something new in their life. So believe me, girls, we were having power, magical power in our hands, but now we have a power in our finger. Through this transvaginal approach, transrectal approach, you can even strengthen the pelvic floor, or you can even relax the pelvic floor and help all the female in improving their quality of life. So thank you so much. This was my session about the importance of pelvic floor, and this is you guys as a physiotherapist who can come forward, learn this topic, and help the female. We are very shy. We don't even disclose our problems. Most of our problems are under the rug. Okay, we try to hide our problem. So, but we have to be loud as a physiotherapist. The muscle is there. If the muscle has a problem, we can definitely support. So thank you so much for having me today with you, with all of you. And I'm so glad that you all joined me. Thank you. If you have any question, you can ask me. We still have 6 minutes to go. Thank you. Let me go through the chat box. If there's any question, we can Okay, there's one question from, can breathe exercise improve the muscle strength if it's neurological impacted? Definitely. There are nerves which is somewhere affecting which is supplying all these organs. So many nerves which supply directly bladder, urethra, pelvic floor, that we can do the stimulation to those nerves. And by nerve stimulation, we can increase the strength. Definitely, we can help our patient by increase in the cases of neurological impacted, in case of stroke, spina bifida, whenever we can found that the pudendal nerve, which is very, very important nerve, so we can always take care of those nerves by electrical stimulations. Yes, we can do that. Thank you, Dr. Shobna. I know when to introduce dilator therapy for vaginismus patient. May I know? Okay, look, dilator is a second stage. There are some stages. Your patient should be comfortable with you. He should be ready. She should be ready for the gynecological exam or this pelvic floor examination. Once she's ready, we have to first check that superficial muscles. So these are the superficial muscles. You cannot go inside directly. You have to first assess those muscles superficially with the palpation, and the abdominal muscle or this coccygeal muscle. You have to first see the accessory muscle tightness. And if there's a spasm and tightness into the accessory areas around the pelvic region, tight glutes, tight adductors, we have to first relax that and relax the superficial muscle. And then the second stage will go around the vagina. First, we'll relax the rectal area and then we'll go around the vaginal area. So dilator will be the third stage. Once she don't have any pain into the palpation around externally. So you can touch anywhere and she's telling you, no, I don't have any pain into the external touch. So only when you are touching the vagina, she's having pain. So in this case also, you have to, that is a vaginismus. So in this case also, you have to relax the bulbocavenosis, and after relaxing, once your finger can go inside. So once the finger insertion is pain-free, no pain during finger insertion, then only the second stage, but dilator will come. Okay, dilator, we cannot go through the dilator just from the starting. So make her relax superficially and try to insert the Q-tip or try to insert your finger. And if there's no pain, then we'll proceed to the dilators. Thank you. Physiotherapy for endometriosis. We have to release the adhesions. There are many protocols. You can reduce the adhesions by visual manipulation, by taking care of the external evaluation of the patient. And same way, you can even go for the transvaginal and transrectal approach. And through that also, you can see the status, but where's the tightness into the fascia, and we can create a lot of relaxation. So the physiotherapy treatment is there for endometriosis. That is a separate big issue, different topic. Where you have to create we have to relax the fascia, all the involvement of the fascia, and tightness will be there into the abdominal muscle, pelvic floor muscles. So relax the abdominal muscles and relax the pelvic floor muscles. You can give a big help. So heating modalities, you can use SWD, deep heating modalities, so that she should not have a tightness. So try to relax those areas.
Yeah, hi, Dr. Sunita.
Dear, yes.
You have really picked up really nice topic, and it's really untouched, and you mentioned about each and everything, and I really appreciate the way you mentioned it about it's not about the only after pregnancy, something which you are focusing for the pelvic floor muscles. It's about each and every age group and both the gender, and even in sports and all, everybody need to be work on beyond the other muscles and everything. So I'm really waiting for your weekend workshop also. So I'll see you there.
Thank you so much.
Thank you so much for the informative session.
Thank you. Thank you.
Thank you. Yeah.
Can I see you? Where are you?
Yeah.
Okay. Yeah, you're here. Hi.
Hi.
Nice to have you.
Yeah, that's what I thought to be. Correct. So that's what I thought,
Coming,
definitely I should appreciate, the way you're making an effort to be targeting each and every people. So, and I would like to tell everyone, I know Dr. Sunita from very, very long time, I think more than 10 years plus, and still, I love to listen her each and every session. And whenever I get opportunity, I try to make sure join. And my few of Anka has joined the session with you. I really, I love when anybody I get to know and that they get informative session with you. So this is something really untouched topic, but and the way you explain it is very differently. We listen here, many people, and we have everybody have enough of information and the books, but no one make an effort to go through that one. So the way you connect, that definitely make people again to think about it. And so that's the way you create the curiosity. So that is the best part of your way. Thank you. Thank you so much.
Thank you so much, ma'am. Thank you for joining me. Thank you.
Sure.
Hi, anyone? Any question? What is the role of pelvic floor muscles in infertility issue? Please show some light on the topic. Dr. Vandana, very important, very nicely, like it is a very important question actually, which you have asked. I just want to tell you, if the muscles are tight, the patient is having vaginismus. So vaginismus means there will be no penetration inside the vagina. If there will be no penetration, so the male organ, penis, the entry of the penis will not be there. If the entry of penis is not there, so you can understand that she will not have ejaculation inside. So penis can't go inside the vagina. If there is no insertion of the penis, no ejaculation. If there is no ejaculation of the sperm, so you can say she can't get pregnant. So vaginismus is a one problem where no penetration. If no penetration, no ejaculation. And if no ejaculation, no fertility, and she will not get pregnant. And it really affects all the patients who are suffering from vaginismus. It is their need that they want to become mother, but they can't become mother because they can't have sex inside the vagina. So yes, pelvic floor has a role in infertility. You relax the muscles, make the female to have a pain-free intercourse, so she can have a better relationship with the partner, and she can even have a good ejaculation, and the sperm can enter inside. So that is the main door from where the penis has to go in. Okay, so it has a role. Thank you, Dr. Vanna. It is a very important question. And what is the role of pelvic floor? Yeah, I answered that. I'm missing the coming weekend session due to some important commitment. Can I know future workshops in Bangalore? Definitely we'll get you to, we'll keep updating you. We'll keep updating you. Thank you, everyone. I'm so happy that I got all of you today and I got a chance to connect with all of you. And you are into the group and you have my number. Doesn't matter you are there into the workshop or not. If you are there, you are going to learn a lot of new things from me. And our focus are more into the practical sessions. That's why I'm trying to take online sessions for them. So we can spend more time into practice. But don't worry if you are not into the session because of any reason, that can be anything. No problem. Whenever you have any question and that any patient comes in contact with you, where you think that Madam told me, Dr. Sunita informed me that in this case we have a role, and the patient comes to you, please give me a call. I'll just message me, leave your message. I'll get back to you. And doesn't matter you are trained into the pelvic floor or not. I'll try to make you understand your patient condition. So in this way also you can keep learning more and you can keep doing this self-practice. Okay, so don't hesitate. Doesn't matter you were there with me in the workshop or not. I'm always there for you. Thank you so much. Dr. Shilpa is asking, does C-section also has impact on weak pelvic floor? Yes, definitely. A C-section, you can understand that throughout the pregnancy, it was a 9 month of loading onto the pelvic floor. So definitely pelvic floor will be weak. But in C-section, there will be mixed pelvic floor condition. So female will have weakness also, and she will have tightness also. So because the abdominal, all this muscle, there will be big surgery. So big cut, big scarring, big adhesions. That adhesion into the transverse abdominis, those abdominal muscles can go and it can create a tightness into the pelvic floor fascia. So those patients, the female who has a C-section, they will be the patient of hypertonous pelvic floor. So they will have more tendency to develop tightness into the pelvic floor. So if you just ask me, so they will definitely, they can be either the cases of patient of the hypertonous or the mixed pelvic floor, which have one segment weak and one upper side, like your vaginal area or rectal area, urogenital area will be tight, will be weak, and the rectal area can be tight. So yes, C-section also has an impact on not only weak pelvic floor, on the pelvic floor. It can create a tightness into the pelvic floor. What is the role of pelvic? Yeah, we done that. Okay, any other question? Management of transobturated tape. So that is kind of quite deeper things. You can ask, like try to join the sessions more for that, learn the pelvic floor more. Okay, so we'll understand. So that was the basics which I told you today. And please join me. Please, you can always connect with me whenever you have any problem. Okay, take care of yourself. Look after, love yourself, shower your love to the community, all the women's, understand, try to understand your own self as women. So you can help, you can understand yourself, you can even help them more women into the society. Bye-bye. I'm ending my session.